Okay. So, oops. Okay, so be careful when you put this in, right? Don't leave it down here.
Oh my gosh, I completely forgot.
That's good. Good job putting the thing up to the top. Okay, so upper airway, we have AP and lateral. Both of them use the 10 by 12. What is the main difference between them?
The SID.
SID, good. So what is this set up for?
Dough is thicker than
Sounds
batter.
from lateral.
Batter is thin like
What
liquid,
the-
so that
Google. Okay, so what is this set up for?
72 is the lateral.
Sorry, lateral.
Airway.
Good. Okay, so let's see. Okay, so John and Matthias, come on up. All right. So you will be using a shield for this, as always, AP and lateral, but we're just going to try and do this quickly.
Sure.
So John, over here, Matthias, you're going to be the tech. So we need to put John in a lateral position. Don't worry about it. Okay. We're just going to try and just do the positioning. Okay, lateral position.
Okay,
lateral.
I'm gonna.
So just turn him lateral.
You want me center first?
Okay, so centering for this, what we're going to do, look for jugular notch. Okay, for females, you're just going to go 2 inches up. For males, you can actually look for that Adam's apple and go midway between the Adam's apple and the jugular notch. Okay. So you see that Adam's apple here. So look for the bottom. So use this. So take here's the bottom of the Adam's apple. Here's the jugular notch. I want you to center right in between these 2 points. Right in between, right in between, right in between. Okay, good. Okay, so for most people, this is about 2 inches above the jugular notch. So if you're working with a female, you don't have an Adam's apple that you can see, right? Just go 2 inches up. So this is about the level of C6, C7. Good. Yeah, crazy machines can't recognize it. Good. Put that in there. So for your horizontal centering, you're going to be at MCP. Okay? For a lot of patients, by default, when they stand, the head causes the neck to dip forwards. So you want the head to be kind of back a little bit. Right, so you have this neck nice and straight, easy MCP to look for. Okay. Because we're doing a lateral, you also want to make sure the patient is in a lateral. So feel the shoulders. Okay. So this shoulder is a little bit too far back. Perfect. And then slide his whole body forwards. Okay, right there, MCP. Okay. Then right in front of him. Okay, right in front of him. Look him in the eye. How does this head look? Don't turn his shoulders for this.
Okay.
Make sure he's turning his head. Good. Okay. And now we're going to collimate. Right, so we're C6, C7 right here. We're at MCP. Our collimation is going to go right here underneath the EAM. Okay, right here at the middle of the ear. Okay. Our collimation should be also right under the nose. If it's not, have them lift the chin up. Okay. It should be right underneath the nose there. Horizontally, we're just going to come in as close as possible. Right, so get right here behind the neck. Use a horizontal one. Get right there behind the neck. All the way, all the way. Good. And that should give you just enough light in front to put your left marker. Okay, so put that left marker down here. Right inside the lid. Perfect. Okay. Now, for some people, the shoulders are kind of big, they're kind of thick, they get in the way of this upper airway. So the last thing you can do is you can actually ask them to take their hands and just like Javier's doing, hold them behind the back. This helps to pull the shoulders back slightly, get away from that trachea, and you can see it nice and clear. Good. All right, so this is lateral upper airway. Make sense?
Yes.
Right, what are the breathing instructions?
Take a deep breath in. X-ray. You can relax.
Good, so that's your breathing, X-ray, perfect. All right, you can relax, John. Okay, and now let's